Thank you, Mr Speaker. I rise this morning to speak around our health system in Tasmania and want to reflect on a couple of comments that were made this morning through question time, one about our incredible healthcare workers and one about the healthcare system. There was a reference this morning that our nurses, our midwives, our paramedics are resilient. There was another comment this morning about keeping people out of hospital, and I just want to open with a comment on that. Anyone that's worked in an environment or in fact has had a personal experience of trauma or fatigue or exhaustion or just trouble, they like to support themselves and say, you know, we're resilient, we can be resilient, we encourage people to be resilient. But when time on time, trauma on trauma, tough on tough, hard on hard, someone says to you, oh, it's so good that you're resilient, and celebrates that you're resilient when you are completely spent, it is so disrespectful, and it is so outside the realm of understanding how hard and how horrible life is for the person that is then celebrated to be resilient. Yesterday, I read into the Parliament some personal experiences, some personal letters from people that work, from nurses and midwives that work within our system. And today we have nurses and midwives striking on the northwest. From one of those members on the northwest, a letter that had already been written, that had already raised to the attention of the Premier and Minister for Health their concerns, but with no response that adequately addressed their concerns. They've had to, at complete frustration, walk out and strike this afternoon. They wrote, Premier, yesterday I left work in tears. I physically walked out of my shift once again in tears at the poor workload I had walked into at the commencement of my shift at 7 a.m. We were working 2 staff down that day, again, with highly unwell patients. No meal breaks were taken, only one at 1:30 when I was mentally exhausted and I walked out crying. The workload pressure of double shifts, working staff down, is a mental strain no one should have to face. We, as all nurses, are beyond exhausted. How can we look after acutely unwell patients when all your workforce is burnt out? We're going on strike. These are people that are burnt out, that are emotionally exhausted and in tears before, during and after a shift. They don't want to be called resilient. They don't want chocolates in a cuppa. They want a government that is going to respond to the realities of the concerns they're raising around being able to recruit, retain and look after the staff in the system. People don't want to, and as others have said this morning, people don't want to take this type of action. People go into these careers, they commit their lifetime, dedicate their hours away from their families to caring for Tasmanians. That's what they want to be doing, but they want to be doing it in a safe way. They want to be doing it in a way that's recognised and supported so they can actually deliver the care, reasonable care, the care of the basics, to look after the basics of care for Tasmanians. But this morning as well, there's also a comment about, you know, we're working to keep people out of hospital. Tasmanian Labor have been committed to raising the concerns about the cost of living, the pressures in our community, and whether it be fuel, whether it be groceries, but we're really committed to highlighting the concerns around energy prices and the increase in energy prices. Now, when we had the energy conversation and then we had a health conversation and the government saying we've got to keep people out of hospitals, I don't know whether this government is in touch enough to hear the stories from people where just recently in the northern suburbs of Launceston, I was told that families, multiple people, not just one person, but multiple households are going to bed at 5 o'clock so they don't have to turn the lights on, so they don't have to have heating. They're not using power at the moment in their community. This raises illness. This heightens the need for health services in our community when all of these things intersect. So you can't, and as someone just said, list out all of the things that you're doing and the new services that you're offering without caring for the core of the service, which is the people. Further on the northwest coast, a letter was written by a midwife. I'm a midwife and our conditions are shocking. A majority of our shifts we do not get breaks and the care we are able to give our patients is average. We have new midwives coming through working and learning in these conditions, and it's a huge concern because these junior midwives are required to learn and try their best in these conditions but are unable to, and we're unable to give them the support and education they need, and therefore this will be detrimental in the future of nursing and midwifery in Tasmania. Not only is this unsafe for our patients, it also means that we have midwives that have just trained and then leave the industry straight away, because who wants to work in these horrible, stressful environments? Most of the midwives I work with discuss on a daily basis how they just want to leave the industry. And if the government doesn't do more, there won't be midwives left to deliver safe care to women and babies, and therefore there will be higher morbidity and mortality rates in maternity areas. Now, when we're having this information shared with us directly, when we're actually out in community and hearing from or taking note of the messages that are shared, you get to understand what's needed in response. But it feels like this government is protected away in some sort of bubble where this information's not getting through, where an understanding of the realities in the community is no longer just vulnerable low-income workers, but people across our community, across all demographics in our community, are struggling from the lack of healthcare service to support themselves to live a good life, and from the increasing cost of living, which is seeing them being more and more unwell in the community. We don't need to celebrate our healthcare workers and say that they're resilient. We need to celebrate the great work that they do, but more importantly, what they want is they want support with the recruitment, with retention, and with the support of them while they're at work. They want to be heard and understood so they don't have to be anxious about the idea of waking up and going to work. Like someone I know in my community that's actually stopped taking shifts and is now doing less and less hours because they can't cope with the thought of going to work and going back into that environment. We don't want people to break down in the middle of their shift and cry, or to go home and cry, stressed, unable to connect with their family. We need a government that supports our healthcare workers, that puts in place a great system to support Tasmanians, and we need that action today.